Thank you for coming. My name is Tammy. I'm with Better Spaces, and we partner with buildings and companies, and we're here to help you connect, create, and perform at your highest potential. So today we're speaking with Dr. Paul about getting in shape to run. And we have another session next week on running and the following week on golf. So talk to all your golf friends. So a little bit about Dr. Paul. He received his doctorate of physical therapy from Mercy College and a BS in exercise physiology from Rutgers. His love of movement, fitness, and golf has blended to create his treatment philosophy, which is move better, feel better, and play better. So I am going to hand it off to Dr. Paul.
All right. Thanks, Tammy. I'm so excited. Let's start this off here. 3 secrets to preventing foot, knee pain while we run, right? So let's get into it. So my first thing, I got to tell everybody, I got to put this disclaimer up that this is not physical therapy. It's not medical advice, but it is some very important tips and helpful tips that'll help you avoid knee and ankle pain when you run. So the big thing that I always have to tell people is that you have to get in shape to run, but not run to get in shape, because running may be very simple. It has the lowest barrier of entry for any cardiovascular exercise routine, but there's a high incidence of overuse injuries because, one, you got long training hours. It's a repetitive motion in one direction. And then a lot of times people that come to me because they just don't know how much miles. I've seen people like run like more than 40 miles per week. And that's just asking for injury, right? So the body knows movement. It doesn't know muscle. So when you're talking about, all right, I have to get from point A to point B, your body will just use the least path of resistance, right? So if you have a weakness somewhere in the chain of the body, which we'll talk to in a moment, then your body's just going to work around that weak link until it breaks. It's sort of like driving your car with a spare tire on it, right? It's okay for a couple miles, but you can't do that long term. So the body works on this alternating pattern of mobility and stability. If this pattern is disrupted, then pain or injury is the result. So if we look at it, particularly the lower body, we're concerned about the knee or the ankle or the foot, right? So the knee and the foot, that's what we're talking about. But it's not just about the knee and the foot, is it? We're talking about the whole limb. The knee is classified as a stable segment, and the foot is classified as a stable segment as well. So what are the things between that? You've got the hip, which is supposed to be mobile, and then the ankle, which is supposed to be mobile. So we're going to talk about what happens when we lose mobility in the hip or lose mobility in the foot or lose mobility in the ankle. Then we get injury or pain in the foot or the knee, because the roles get reversed because your body's like, all right, fine. If I'm tight in one spot, I'm going to get that mobility somewhere else. So here's our first thing that I want to talk about. Pronation is not bad. The lack of pronation control or uncontrolled pronation is bad. The foot, when it hits the ground, naturally flattens out. That's called pronation, right? So let's talk about, look at this graph here. When this is somebody walking. So the first thing that hits the ground is going to be the heel. And then when you're weight bearing, when you get your weight on your foot, you should do a little bit of pronation. So the foot goes flat. It certainly does, right? If it doesn't go flat, then your body's not going to absorb any of that shock. Then you have a very stiff foot. Then that's another host of problems. But what happens is as your heel comes off the ground, you should resupinate, it's called. So you should regain that arch back. And a lot of times, by the way, if you are a runner and you're landing like this with the heel first, you're probably having some issues. So ideally, heel strike, which we'll talk about next week, is something that might not be the best efficient way to run. So the ITB myth. The ITB, it stands for iliotibial band. You probably heard of iliotibial band syndrome. And the big thing is that if you've had lateral hip or lateral knee pain, like, oh, my IT band's so tight. You know what? I'm going to tell you that the IT band is a tendon ligament hybrid. A tendon connects muscle to bone, and a ligament connects bone to bone. So this IT band comes from the top of your pelvis and then down the side of your leg and inserts into the side of your knee. But it does have that tensor fasciolata muscle there, which makes it a tendon technically. And you know what? They've done cadaver studies, and this IT band, this structure is so dense and robust. You have to stretch it with it won't stretch unless you put like 800 or 900 pounds on it. So if you're foam rolling, trying to stretch out your IT band, I'm going to tell you, you're wasting time, because that sucker is so strong. It doesn't elongate. It doesn't get longer. Where you can get the most bang for your buck, if you're trying to reduce some of that tightness, is to attack that tensor fascial lateral. We'll talk about that next. All right. So let's go into a hip flexor stretch. When you're running, the leg has to come up behind you. And what that does is it's called hip extension, right? Hip extension. When your hip and your leg comes behind you, the front part of your body has to be mobile. It has to be long. It has to be flexible. So this is our test. This is the Thomas test, we call it. And you get on the table, edge of your table. I'm going to show you this in a second. And then you lie back with one knee into your chest, and you look at where your leg, your other leg goes. It should be totally flat, 90 degrees, and your knee bent 90 degrees. If you don't get that and the knee is somewhere else and your leg is pointing somewhere else, then that indicates that there's something tight in the front part of your IT band, or your hip flexor, or your quad, or stuff like that. So there's a lot of things that can go wrong with that test. Now, the other thing is, for runners, to avoid hip or knee and ankle pain or foot pain, is you have to cross train, right? So running is very just one directional, right? There's a lot of repetitive stress and overuse that can happen. So you have to vary your workout. The workout needs to also include movements that go sideways, lateral, rotation, because if you really think about it, when you run, there is a lot of rotation that happens. When your foot hits the ground, there's a moment where you are on one leg and your body has to rotate around that hip. Your arms go one way while the opposite leg goes in front. So there is this rotation of the top half and a counter rotation of your lower half. So you have to vary your workout positions, directions of movement, and also add load, right? Because you think about, it's like 4 to 8 times your body weight every time your foot hits the ground. So these are some things that we're going to go through today. The IT band, TFL release, the gluteus medius strengthening, and some foot and ankle mobility. So I'm going to switch this up so you can see what I'm going to be doing. And then first we're going to go talk about our hip flexor test, right? So I'm gonna just pull this out, get my ball ready. So you're gonna grab a table. Hopefully you guys can see me. Got 2 cameras here. I got one here, one over there. You're gonna get the edge of your table, couch, coffee table, whatever. You're gonna hug one knee into your chest. I'm gonna hug my left knee so you can see what happens with my right leg. So as I hug that into my chest, I'm checking, can I bring my knee into my chest? Do I have sufficient hip and knee bending, flexion, to get into this position? Once I'm on the edge here, I've got my foot on the ground, I'm going to relax my right leg. And as I fall back, I'm going to see, can I keep that angle? And then what happens to this knee? If I relax this leg, ideally, my thigh should be parallel to the ground and in line with the rest of my body. Shoulder, hip, knee should be straight. If it's sticking out to the side or up like this, that means you've got a tight anterior chain, we call it, and we got to stretch that out. So if you're in this shape and you're not able to get into a nice relaxed 90-degree bend of the knee, then we've got a tight front part of your hip. So every time you're getting into the shape, it's basically a running shape. This front half, it's too tight. So if that is tight, that might cause some knee pain. All right, the next one is this tensor fascial lateral or IT band release. What we're going to do is we're going to get this ball. I've got it's a trigger point ball, but you could use a tennis ball, lacrosse ball, or something like that. This IT band, this iliotibial band, starts right off of the top part of your pelvis, just in front of your hip bone. So it's generally in this pocket area. And you're just going to put that ball right on top of that, and you're going to lie on top of it, right? So I'm going to get on my side. All right. I got my knee bent and my hip bent. And what that does is create slack in my IT band and tensor fascial lateral muscle so that I can put that ball in there. So it should be fine, right? So the table's soft, and you can imagine if you got this done on the floor, it'd be much more extreme. But then what you do is you kind of roll that around, find a trigger point, right? The trigger point is going to be something that's a little bit uncomfortable to get on, a little bit painful. And we're going to try and work on breathing and use our nervous system, making our exhale twice as long as our inhale, through the nose, out through the nose, in through the nose, out through the nose, so that we can allow that muscle to relax. Once we have that muscle relax and we accommodate to that pressure with the ball, then we're just going to straighten out that knee. We're going to straighten out that knee and try and make this hip extend into our running pose, right? So I'm going to take this leg back, right? So moving it behind me, I could reposition my top leg. I'm going to roll forward and apply more pressure on this iliotibial band and the tensor fascia lata muscle. So what I do is I pin that down and work into ranges of motion where I feel uncomfortable, but when you stop, it should be no worse. So I recommend using this type of release, trigger point for release, for at least 2 minutes. So 2 minutes a pop. That way that you can allow that muscle to relax and then get into the soft tissue and allow that to lengthen. So the next thing I want to talk about is the glute medius strengthening. So the glute medius is part of this gluteus group, right? So we've got the gluteus maximus, which is the big butt muscle. And then the next one underneath that is the gluteus medius. And that runs like almost vertically. And what that does is controls your body when you're in this position, basically standing on one leg, right? So if we're standing on one leg, this is the shape that we make when we're running. We have to think, all right, where does my body want to go? Do I want to fall this way or do I want to fall that way? When you're running, the pelvis and the rest of your trunk should be very balanced. If you put your hands on the top part of your hip here and you pick up one leg and kind of make like a running pose, does the pelvis remain level? And does your body remain straight, right? That muscle, if it's strong, is going to counteract the weight of your trunk and this leg over this hip. So it's super important to get that stronger. So what you're going to do is you make the test the exercise. We just kind of make sure that we've got this knee bent up, right? So it's almost like a running pose. We've got a little bit of a bend in your standing leg. Put your hands on your hips. If you've got a mirror, that's awesome, right? We're going to look into the mirror and make sure that we can maintain a good level pelvis and then maintain the level shoulders and trunk. And then finally, we think, all right, what's going on with my foot? Can I maintain good stability through my foot? I want to have the weight evenly distributed between my heel, my pinky toe, and my big toe. And if we hold this for about a minute, what's going to happen? Hopefully, you get this burn that's going on into this gluteus medius. You should feel this in your hip. If you feel it in the front or your thigh, that means that your body is, again, working around the weaknesses, compensating for a weak gluteus by using your quad or that TFL muscle. And if that is overactive and this is underactive, that's why we've got this lateral knee pain, this IT band syndrome that comes up. So if that's easy for you, we're going to take that single leg stance, holding our pelvis straight. We're going to put our arms in this running position, which is about 90-degree bend with the fingers touching just lightly. And then we're going to swing this back and forth. We basically get these elbows going back and forth and see, can we still maintain a stable pelvis and a stable trunk? It gets harder once you start to move, right? And then we can even make this more difficult by lifting this knee up in front. If I lift this knee up in front to hip height, that creates a more difficult position because we're raising your center of gravity. Once we do that, can we do the same thing? All right. So if we are stable on one leg, you should start to feel that burn, right? So let's just say if we can do one of those modifications or one of those versions for a minute, that'll help strengthen your gluteus medius and prevent you from having knee or foot pain. So the next thing we want to do, and the final thing, is we're going to talk about this foot and ankle mobility. So with that joint by joint approach that I showed earlier, the ankle needs to be flexible. So if we're looking at the way that you're running and you put your foot on the ground, the knee has to transverse in front of that, right? It has to move forward. And if a lot of times people who wear like heels or don't get into, walk barefoot that often, they tend to lose what we call dorsiflexion. So if you look at my foot, it's basically that, lifting the toe off the ground, right? You should functionally be able to walk on your heels, maintaining about 15 to 10 degrees of dorsiflexion in the ankle. So you should be comfortable in this position, right? If you don't have that range, one way that we could check that, I'm going to hop up on my table here so you can see this better, is that if I get into a half kneeling position and I draw an imaginary line that is 4 inches in front of my toe here, so that's where my finger is, my knee should be able to hit that line, okay, without my heel coming up. That is functional dorsiflexion right there. A lot of times people will be short about, they'll get like maybe 2 inches or so. So the one thing is that, again, our test can become our exercise, right? So something simple as this, just getting into a lunging position, pushing the knee forward, keeping the heel down. Another one that I like to do is get a vertical surface. So it can be anything, it could be a wall. For camera purposes, I'm going to use the leg of my table. What I do is I put my foot up, I prop my foot as high as I can with a little bit of space between me and my foot. And then keeping that heel locked in the ground and my ball of my foot on that vertical surface, I'm going to push my knee forward. All right, so you can see what happens here is that I'm creating that angle, that dorsiflexion angle, and I'm actually bending my big toe and my toes backwards too. So that also helps facilitate what happens in the foot when you run, right? So we should get dorsiflexion, and there should be some toe extension as well, right? So basically that's a shape where we want to be like this when we're running. Here we go. That's it, right? So that's the dorsiflexion shape. We want to be able to flex through the toes. And then when we run, we want to allow that knee to pass forward over the ankle. So that we want to have a mobile, flexible ankle. And then the mobile and flexible your ankle is, the less foot pain that you'll have. I know a lot of times people will go into like plantar fasciitis or something like that. And then I look at their ankle and it's super tight. So those are 3 ways that you could prevent hip and knee pain when you go out and run. Hopefully you find that helpful. You try these out. And if you have any questions, let me know. If there's anything in the chat here. Any questions in the chat, Tammy?
No, but I have a question. So are you
Sure.
saying that if you have plantar fasciitis, it could be your ankle?
Yes, 100%. So a lot of times that plantar fasciitis, that structure underneath the, from the heel to your toe, right, creates this little spring. When your foot hits the ground, we've got that lengthening of the spring. And then when your foot goes in the air, when you pick it up, there's a shortening of that spring. And that creates a lever for all the structures above there, your lower leg, your calf muscles, for all of those structures to work off of this area. So if you're tight in the ankle, your body will think, all right, if I'm tight here, where do I get that range of motion? Where can I get that flexibility? I'll unlock the knee, or I'll just let loose this thing, or my foot will be more of a pronated or flat position, and that creates a more dysfunctional foot posture.
Okay, we have a question. Any exercises for alleviating pain associated with neuromas in the feet?
So neuromas are tough because, one, they're basically an irritation of this nerve that comes like in between the toe bones, right? So and it's usually experienced with like overuse of very narrow shoes. And once that nerve gets irritated, it's very hard for that nerve to calm down. So the one thing that I do is we have to work on the soft tissue that's inside the bottom part of your foot. So we could take that ball that we used for the hip, the tensor fasciae lata muscle, and we could roll that underneath. Now there's going to be some parts where, especially like in the mid part of your foot where you roll, it might be painful because you're pushing right on that nerve. What I would do is work around that, try and loosen up the rest of that spot. And then you take your, you take your foot and then you hold your foot with your fingers, right? So you have like, your feet are kind of like glued together. What you got your big toe like that. You just take your hand, you put your foot in there, and you kind of shove your fingers right in between the toes to create separation. And what that does, it opens up the bones, the foot bones, to create some relief of the nerves that go in between the bones. Those are probably 2 big ones that I usually give my clients.
Okay, how about suggestions for Achilles soreness?
So you think about, what does the Achilles do? We went over that half kneeling test, and let me grab this stick here. So if we have an Achilles issue, it's either because it is super tight and we can't get into this range of motion. So again, there's that 4 inches. I want to be able to put my knee and touch that vertical line. If the Achilles is irritated and there's, say, a tendon pathology, what happens is that those fibers that are inside that tendon, they get irritated and they're not organized. So think about like the fibers of a muscle and tendon are like the fibers of a nice shirt. You don't want those fibers to be wrinkled. You want them to be horizontal and be organized so that they can lengthen and shorten. So what I could do is think about, getting into the Achilles tendon right at the back of the heel. And this is a trigger point ball. If you get a lacrosse ball, which is a little bit tacky, you can start to mobilize that tissue a little bit. So it's sort of like you could get your thumb on there. I think massaging the Achilles tendon is step 1, right? So if we look at the structure of what happened, it basically gets kind of frayed or gets disorganized. So with some type of mechanical intervention, like a massage or rolling the ball on the Achilles, you kind of break up those knots. You break up that scar tissue, whatever you want to call it. And then after you do that, you follow it up with the stretches like we did over here against a vertical surface, or you could do like the classic, calf stretch where we're lengthening that muscle. So, but once you kind of break up the scar tissue or adhesions, then you could stretch it out, lengthen it, and then hopefully that will allow or facilitate your body's own healing process to take place. And then you get a stronger, more flexible Achilles.